call is now being recorded. So, good evening, everyone. A very warm welcome to all the audience, the speakers, and the hosts who are present in today's presentation. Today, we will be discussing a very interesting, or rather, I can say a very trendy topic, that is a binge eating disorder. So now we must have all known about this term binge eating, since it is quite accustomed to us whenever we are reading a book or like from the graduation or the 12th standards. But do you know this binge eating nowadays has becoming a very alarming topic as it is increasing day by day. Maybe I can say through our by seeing the ads or by seeing posters, eye-catchy posters of different stars, or I can say simply through our mobile app. So today presentation will be a elaborate discussion on this topic where our speakers will highlight and give you an insight about the different aspects, maybe it's psychological or metabolic or different causes and its prevention. So, without losing much time, I will move on to introduce the speakers. Our first speaker of today's presentation is dietitian Sanhita Roy. She have done her graduation in food and nutrition from Bardhaman University, have done her master's in food and nutrition from Vidyasagar University. She's experienced guest teacher of nutrition in a reputed college. She have completed her 6 months RD internship from Dishari Health Point Private Limited. She is currently the clinical dietitian at Guru Gopiram Multispeciality Hospital, Asansol. She is the students of our medical nutrition therapy and have completed the 6 months course and a member of Cognized Nutrition. The second speaker is dietitian Susmita Das. She have done her BSc in food and nutrition from Gaurbanga University. She has pursued her master's in applied nutrition from West Bengal University of Health Sciences. She has also completed 10-month certified nutrition diabetes educator course and completed the 6-month RD internship from Dishari Healthcare Private Limited. She is currently working as a clinical dietitian at Noori Super Speciality Hospital, Malda. She is also a student of Cognized Nutrition and also completed the 6 months MNT course. The next speaker in the row is Ms.Abhighya Chakraborty. She is a consultant dietitian. She have done her BSc in food and nutrition from Calcutta University and pursued her master's in dietetics and food service management from IGNOU. She have also completed her 10 months certified diabetes educator course under NDP and worked as a lifestyle counselor at Apollo Lifestyle. She is a student of Cognized Nutrition and has pursued the 6 months medical nutrition therapy course. The next speaker is dietitian Nikita Sarkar. She have also done her BSc in food and nutrition and MSc from the same from from University of Gaurbanga. She is a working practicing dietitian at Rosa Clinic, Raiganj. She is a student of our Cognized Nutrition and have pursued the 6 months MNT course from the same. Our next speaker in the row is a successful dietitian, Chinmoyee Chatterjee. She certified in food and nutrition from IGNOU, have done her diploma in nutrition and health education from IGNOU. She has pursued BSc in chemistry from Utkal University. She is pursuing dietetics and food service management and post-graduation from IGNOU. She has also completed her 10-month certified nutrition diabetes educator course under NDP. She worked as a nutritionist in different multinational companies for the last 7 years, so she's an experienced dietitian as well. She's currently working as a dietitian at Dr. Reddy's. She's a student of Cognized Nutrition and have done the 6 months MNT course. Last but not the least, our final speaker is dietitian Deblina Viswas. She have done her BSc in food and nutrition from Calcutta University and pursued masters in dietetics and food service management from IGNOU. She have also completed the nutrition National Diabetes Educator course under NDP and completed dietetic internship from Ruby General Hospital. She have completed 3 months internship from KPC Medical College and Hospital as well. She is also a member of Cognized Nutrition family and also pursued the 6 months MNT course from this organization. Now I would like to request all our audience to stay till the end, because at the end we will be having a very interesting role play by 2 of our speakers. Now I will be requesting our host of today's presentation, dietitian Shomendu Ghosh, to give a word for this topic. Over to you, sir. Thank you.
Thank you, Pritha Vishwas, for introducing the topic and introducing all the speakers. I am really thankful to you for your time and all the audience present here. I request to you to stay back till the end. Even I am really thankful to all the six speakers and those who are doing the role play today. It is really a privilege for me to stay with you with a very interesting, but it is, do you know, this history is very old. It was first coined in 1959, binge eating disorder, by psychiatrist Albert Stunkard. So he has noticed the pattern of consuming large amount of food and irregular interval. That is, there is no fixed time of consuming foods. And he has also observed that some of these people episodes were linked on nighttime cravings, that in the daytime they were okay with that, but in the nighttime the craving increases. And in 1987, again in 1994, again 2008, 2013, 2015, day by day, there are many studies and many explanations by American, like Psychiatric Association. They have mentioned binge eating in its diagnostic and statistical manuals of mental disorder, because it is not a social thing or not anything, I mean, especially it is connected with the mental thing, and it is bit different from bulimia nervosa, because bulimia nervosa there is a guilt conscious that people used to take after eating, take lot of water, going for stool or vomit the food. So there is a thing, but here there is a pleasure of eating. Even I have noticed in my patient that when the patient is in during pregnancy or lactation phase, as the doctor has mentioned the term, there is no dieting, you can take each and everything, but in respect the doctor has not said that what you cannot eat. So at that time people used to gain. Nowadays in current scenario 100 kgs or more than 100 kgs during and post pregnancy, and there is big difficulty in reducing. So it is mostly predominant in the women populations, and binge eating disorder is also there are what Pritha has rightly mentioned, that is the fast food junk food centers has increased. Even the traditional foods are mostly, if you see the food bloggers or the food apps, so even I see one Bangalore dosa counter putting lot of cheese, like 30-40 gram cheese, putting in like a pizza. The dosa is just like made like a pizza. So the authentic cuisines are also turned into junk food or unhealthy food. So that is important to notice, that if the patient is saying I am eating dosa, so what type of dosa, how is it cooked? And when the dosa is being prepared in the outlet, they continuously pour oil on that, just like a egg roll. So what the same dosa, when you will prepare at home, you can just pan fry with a minimum, like even half teaspoon of oil is enough to prepare a dosa or prepare a paratha, and which we call fast food, but that are not junk food. So there are certain things you will get to know from the role play, the psychology of the patients. Risk factor associated with binge eating disorders are obviously the family disorder, family pattern of eating, that nowadays families are giving mobile to their child, they are not eating in a same table, so that will can create this disorder. It has some history of trauma or abuse. The family pattern of dysfunctional emotional coping is there. A person's history of food insecurity is there. Mood and depression, anxiety disorder, and substance use disorder. So there are many things, executive dysfunctions. So if you get to know, or if you get to get just indulge in the topic, so you will get to know many things. And type 2 diabetes, obesity, cardiovascular disease, gallstone, fatty liver, kidney disease, osteoarthritis, lack of vitamin D are very common in this disease. But the main thing, knowing the disease is important, but main thing is management of the disease, that we will learn from our speakers today. So thank you. And we can go ahead. Shangita, you can start today's discussion, and all the best to all the speakers. Thank you so much. Moving to the next slide.
Thank you, Pritha, for introducing me. Thank you, sir, and thank you, Cognize Nutrition, for giving me this opportunity. Good evening to all. Good evening, sir. Our today's topic is about binge eating disorder. Before directly jumping into the topic, first we must know that what is binge eating and about the binge eating disorder. Anyone have any idea about binge eating? Then the person take much food in short period of time and the person taking much food taking much food vigorously. When we can call it binge eating disorder, the person eating food at least once a week for 3 months. Next slide. Now here we come to some examples are like a large bag of candy into your room and you finish secretly, eating a whole cake in one sitting and feeling guilty. And one more example I want to add on. A 25-year girl who are struggling binge eating disorder. She feels obsessive around food and feels hungry all the time. She got really intense craving and feels like the starving all the time. Although she is completely full, but she takes 3 pieces of burger in the same time. But this situation she can't control. That's why the girl is suffer from absolutely sick of it and they suffer from this disease for the 10 years. Next slide. Those persons who are suffering from binge eating disorder may show some of the signs and symptoms are like take excess stress and anxiety and they feel uncomfortably full but yet they continue to eat, eating much more rapidly than normal and continue to eat until the uncomfortably full. Consume excess amounts of food in short period of time and feeling desperate to control eating and lose weight and to record the weight fluctuation. Apart from that, the high blood glucose, diabetes, high cholesterol, heart disease, stroke, and gallbladder disease are also occur the in evidence the individuality. Next slide. This slide shows the two types of psychological eating disorders. First is anorexia nervosa and the second is bulimia nervosa. Anorexia nervosa is also an eating disorder. Those persons who are suffering from anorexia nervosa, he or she feel fear of weight gain and the fainting occurs. It is more common in the women, adolescents, women and girls than the adolescents, boys and men. It occurs between 13 to 19 years and mostly risks in early 20s. Next slide. Please pay attention. This slide is very, very important. This slide presents the symptoms of anorexia nervosa. The anorexia nervosa are two types. The first is involves psychiatric traits and the second is metabolic traits. The psychiatric traits represents the depression, anxiety, and now coming to the neurocriticism. Neurocriticism is an experience in negative aspects that includes anger, anxiety, irritability, and self-consciousness. This next is schizophrenia. Schizophrenia that affects a personal ability to think and feel. And the obsessive compulsive disorder is connected to it the repetitive thoughts and fear that lead to compulsive behavior like doubt, aggressive behavior, etc. And The other special metabolic traits, it represents the decreased BMI, decreased fat mass, increased HDL cholesterol, increased physical activity, increased the diabetes, and also decreased leptin level and insulin level. Next slide. Now we are coming to another slide and another eating disorder of which the term is bulimia nervosa. Bulimia nervosa is a recurring episode of binge eating. The self-evaluation is influenced by the body shape and weight, and it also affects the female that starts during the teenage years. Prevalence of bulimia nervosa is approximately 2% in women and 0.5% in men. Next slide. Now, here come to some of the signs and symptoms of bulimia nervosa. Eating a large amount of food in limited time and she feels guilt, shame and anxiety. Purging or vomiting food of the body after eating. Swollen cheeks and jawline, gastrointestinal problems, irregular periods, muscles weakness, dehydrations are also occurs. The person is preoccupied with body weight or shape. That's why excessive he or she doing excessive exercise to the loss, prevent weight gain, and use diet pills and diuretics to control the weight. Next slide. Now we are come to a very alarming topic about the binge eating disorder. According to study conducted on American population, the prevalence of rate of various eating disorder are the first category is the anorexia nervosa is 0.6 to 2%, and the bulimia nervosa is 1 to 4.6%, and the binge eating disorder is 0.6 to 4.5%. This is mostly prevalent in female, and the data suggests that 60% of females are suffering from this. This disorder mostly common in late teens or early 20s, and one difference is there. The females are suffer from in this disease the adulthood, and the male is commonly in midlife. So far we learn about the binge eating disorder. Now the next part will be covered by my speaker Susmita. Handing over to you, Susmita. Thank you.
Thank you, Shanhita, the lovely presentation by you. Thank you, Pritha, for nicely introducing me. Thank you, Shomindu sir, and whole Cognize platform for giving me the opportunity to present to you. Good evening, everyone. The portion of topic you will be going through with me is what are the possible causes of binge eating disorder. The causes of BED can be divided into three sections. Number one, societal causes. Number two, psychological. And in number three, there will be some other causes. Next slide, please. Okay. This slide represents some of the societal causes of BED, like fast-paced digital lifestyle and busy working schedule of today's people, giving rise to the apathy to home cooking. Thereby, the demand of fast food is increasing day by day. And taking the advantage of this, there are numerous food delivery apps on our fingertips and many big shopping malls with their big discount offers. Then also increased trend of partying, celebrations, social meeting, hangouts, frequent family get-togethers, and Netflix and chill. That means entertainment purpose causing voracious eating can also add a valid point to binge eating disorder. Next slide, please. Okay, thank you. This slide is about some psychological causes like emotional eating due to childhood trauma, low self-esteem, failure, anxiety, and depression. Also may be due to nuclear family, working parents, unavailable emotional nourishment, and lonely childhood. Then due to fear of loneliness or abandonment. That means to fit in a society or a particular friend circle, sometimes some people tend to follow an inappropriate diet pattern. Like during party or celebration, they tend to eat more pizzas or cold drinks, etc. And this can lead to BD also. Then psychological triggers like mouth-watering food advertisements, social media influencers, food bloggers can easily tease a foodie by igniting their deadly craving. They are the easiest prey after all. Then also dependency on canned refrigerated foods, drinks, snacks, or chips, especially during watching any movies, web series, sports, TV serials, or any other form of entertainment. This can also increase the food craving and also lead to food lust and food indulgence. Next slide, please. Okay, this is a very interesting slide. So as you can see, this slide represents the cycle of emotional eating. During any stress or anxiety, everyone needs some comfort. So sometimes some people think that eating any food can provide them some comfort. And they do they eat some unhealthy foods like chips, burgers, pastry, as you can see in this picture. And after eating all these junks, they get relieved and feels good for some time, which doesn't persist for a long. So after some time, when the positive feeling fades, the guilt feeling and stress came back again to him or her, and thus this cycle continuously repeated again and again. Next slide, please. Okay. Apart from the societal and psychological causes, some other causes can also lead to BED, like genetic trend of voracious eaters in family, then ignorance, unawareness, and lack of education about the rule of food consumption and nutritional level. Then evening time or midnight food craving that is unbearable to control. Then traveling to new place and excitement to experiment with food, especially street and restaurant foods. Then weather change. Due to weather change, sometimes the craving of certain type of food or liquor is increased, like hot momos, then gravy chow mein, soups during cold season, and cold or refrigerated food items like cold drinks, ice cream during summer. The next point I want to really highlight as a cause of BD is some enforced diet restriction like crash diet. So, young generation, we all know that young generation tends to go fast, and this goes with their dieting style also. I will explain it with a practical example. We all know that Durga Puja is knocking at our door, right? And and we all want to look good, pretty, and attractive. So what happens that sometimes some people think that if they lose body weight, a little body weight, they will look more pretty and more attractive. So they land up. So to reduce body weight in a very short span of time, what they do land up on Google and follow an inappropriate, unhealthy diet schedule and meal pattern, which eventually badly affects their health, causing temporary weight loss, then poor digestion, then nutrient deficiencies, and a constant feeling of low in energy. This also plays with their mood and psychology as well. Because after following this type of food or diet, they feel a strong craving towards some puchkas or pastries like this. So, my message to you all or to common people, if you really want to lose weight, please go and visit a dietitian. He or she can guide you in this journey in a scientific way. Next slide, please. So, these are some pictorial representation how BET can offer. Like as you can see, some eye-catching mouth-watering offers and large food hoarding like this. This can trigger binge eating or this can trigger the craving of this food. Next slide, please. Okay. From this slide, from these pictures, I think we all can relate that we all do overeat during any party, celebration, or any occasion. So, consumption of excessive unhealthy food while partying and celebration can lead to BED. How? That sometimes a huge amount of food is still left in the fridges, and there is an urge to finish all that very in a short time. So, this can develop to binge eating disorder as well, especially if the parties and celebrations are very frequently done. Next slide, please. Okay. This slide has three pictures. And who are they? They are some well-known celebrities. And what do they do? They are promoting unhealthy foods. Celebrities heavily influences the youth of the society. Young generation tend to follow them, whatever they do, positive or negative. So this kind of celebrities promoting and advertising such foods, such unhealthy foods, can have an adverse effect on young minds and can lead to binge eating for them. Next slide, please. This slide also has three pictures. From the first picture, we can clearly see that it is a fridge that is completely loaded with some unhealthy junk foods like chips, cold drinks, as you can see, right? And from the next two pictures, we can see that how kids get easy access to this kind of food from their early ages. This can develop the root of compulsive eating disorder in them. So, now so far we learn about some of the causes of BED. The later part of the presentation has some deleterious effect of BD on human health that will be represented by my next co-speaker, Abhighya. Hand over to Abhighya. Thank you.
Thank you, Susmita, for nicely describing the part. Good evening, everyone. Thank you, Shomendu sir, for giving me this opportunity to present here, and thank you, Preetha, for introducing me. Now, I will discuss on the side effects of binge eating disorder. Please change the slide. Binge eating disorder may result some short-time effects in our body. Like if a person who consumes lot of junk food or refined sugar, that not only they are bad for their overall health, that also causes short-time effects in our body. That also limit the diversity of gut microbiota, which encourage the growth of the bacteria. And those bacteria are responsible for bloating, stomach cramp, constipation, indigestion, fatigue also. Next slide, please. If a person who binge eat at least once in a week for consecutive 3 months, that also affect their body physically and mentally. There are various conditions may arise a person who binge. Those are weight gain. Weight gain is a common or a major factor for binge eating person. Two-thirds of those who are overweight and those person put on extra calorie by eating junk in a short period of time, and that extra calorie are not burned with the exercise. People who binge feel very bad about their weight, and which leads to low self-esteem. That's why also causes overeating, and which also are raises the chances of other health related issues like heart disease. Next slide. Being overweight makes harder for heart to pump blood to the lungs and the other body parts. And having a lot of fat, especially around the chest or the belly, rises the risk of high cholesterol, high blood pressure, etc. And those of boost up the chances of heart attack and the stroke. Next slide, please. People who binge eat are likely to get type 2 diabetes. And if a person having this condition, binge eating may harder to control type 2 diabetes. Increased hunger, frequent urination, numbness of hands, feet, and blurry vision are the signs and symptoms of type 2 diabetes. Next slide, please. Do you know mental health also associated with binge eating disorder? Yes, people also experience signs of depression, anxiety, and stress. And sometimes person feels shame when eating a certain amount of food. and they feel also uncomfortable with how their body look or feels. An individual who binge it more than once in a week may also feel fatigue and lack of energy and making difficult to complete their daily tasks. So far, we learned about the side effects of binge eating disorder. Now, the next part, the prevention of binge eating disorder, will be discussed by our other co-speaker, dietitian Nikita. So, handing over to you, Nikita. Thank you.
Thank you, Dietitian Abhighya. Nicely presented by you. Good evening, everyone. Thank you, Pritha. Thank you, my co-speakers, and thank you, Shaumindu sir, for giving me this opportunity to present here. I will be discussing on this part, prevention of binge eating disorder. Next slide, please. We can consider binge eating is not a disease. It is a disorder. It can be prevented by choosing healthy habits and lifestyle modification. Like, we will advise the patient not to skip meals, plan regular meals and snacks time. Don't stay empty stomach for longer period of time. We will encourage our patient for regular yoga and exercise. It is a good practice and it also helps to maintain our good health. Next is, fluid is very important to prevent dehydration and boost our metabolism. Um, we will advise the patient to take uh, enough fluid, 7 to 8 glasses of water. Not only water, they can have other healthy fluid options like coconut water, dal water, sattu water, lassi, and natural fruit juices. Include more fiber rich foods in the diet. Eating whole grains, fruits, vegetables, and unprocessed foods can help to feel full and satisfied compared to eating refined grains, sugars, and processed foods. Fiber-rich foods also helps in reducing lower cholesterol and blood sugar while reducing the risk of heart disease and diabetes. Get rid of all the misconception about eating, like outside ready-made food are alternative option of homemade food, or skipping meals can help in reducing weight. Sleep is very important. To get rid of stress, take adequate sleep, 7 to 8 hours in a day. Uh, we will ask the patient to reduce screen time and mobile time before sleeping, um, and practice a healthy sleeping habit before going to bed. We all know the poem, which is early to bed and early to rise makes a man healthy and wealthy. Wealthy. We should follow this poem uh, our daily life. Next slide, please. Mindful eating. Uh, this slide represent this slide represent this slide represent mindful eating. Do you know what is mindful eating? Mindful eating includes to observe the food first, then eating slowly and purposefully. It allows to enjoy the flavors and texture of food and helps to recognize our satiety cues. Next slide, please. Here we can see the two pictures. First one shows spending time with family and friends, telling them about how you feel, your fear, and your anxiety and psychological stress, and how you feel, how you have no control on them. Your loved ones can help you to get out from this unwell state. Now coming to the second picture, which depicts relaxation, like listening to some soothing music, or playing with pets. Do whatever you want and whatever makes you feel good and happy. You can also have a weekend short trip, and instead of paying attention uh, electronic gadgets, you can spend a quality time with family and friends. uh, Next slide please. This slide represents halt technique. Halt stands for hungry, angry, lonely, and tired. Halt technique has two physical states, hunger and tired, and two emotional states, anger and lonely. To use the halt method, ask ask yourself how you feel. If you feel hungry, then eat some healthy snacks and drink water. If you feel angry, then move your body, walk outside and get fresh air. If you feel lonely, then call someone, watch funny videos, playing with pets. If you feel tired, then take a break, take a nap, listen to something soothing. It is a good balance because you are taking care of yourself physically and emotionally. Next slide, please. This slide is all about role of a dietitian. We have to educate people about binge eating disorder and its side effects. We should counsel the patient about meals and snack times. Next point is very important. It is nutritional labeling. Nutritional labeling is important. You should know about how much calorie, carbohydrate, fat, fibers, proteins, vitamins contains the food. Is it as nutritious from the inside as it is shows from the outside? Uh, we should counsel the patient psychologically and emotionally, and we have to advise the patient have to maintain a food diary whole the day, and we should suggest the patient outside healthy food options. Practice smaller meals more often. Carry food whenever you go outside. Not store unhealthy foods in fridge. Now we will be coming to a very interesting part of our presentation, that is a role play. It will be present by my co-speaker dietitian Chinmoyee and dietitian Deblina. Now over to you both. Thank you.
Thank you, Nikita, for your wonderful insights. Thank you to all the four speakers who have given their presentation so well and make us understood about the various types, causes, prevention, and this as well as management. Now we have came to the very interesting part, as I have mentioned earlier, about the case study. So before moving forward, I would like to give a brief scenario of the case. So two of our speakers, one will be dietitian and the other will be the patient. So I will be giving the introduction of this patient. The patient name is Deblina. Her age is 26 years. Her current body weight is 88 kgs. Her height is 5 feet 7 inch, and as per we have calculated from the height and the weight, her BMI comes as 30.4 kg per meter square. She is diagnosed with obesity and PCOD. As per we have known about the lifestyle, the patient stays outside alone for the past 3 years, and she is working in a corporate sector. So mainly we can understand that she had a sedentary lifestyle surrounding with this job. She mostly tend to take outside food, and most of the time she depends on the junks. Now she is gaining weight, and the problems is associated with PCOD and insulin resistance. Her doctor have referred her to a dietitian. to lose her body weight fast. Now let's see how the dietitian counsel the patient on this lifestyle modification, and how make the patient relieves that the uh, journey is healthier. So now I would like to give the entire platform to our two speakers, dietitian Chinmoyee and Deblina. You can start your role play. There's wisdom. Thank
Thank you, Preeta. Thank you so much for the explanation. And thank you all the speakers. And thank you, Shomendu sir, for giving us this platform. Now we're going to show the role play for a practical example.
you. You can start.
Excuse me, ma'am. May I come in?
Yes, please come and be seated.
Thank you.
And may I see your report and prescription, ma'am?
Yes, sure, ma'am. Here it is.
मैम आप अभी क्या प्रॉब्लम फेस कर रहे हो?
एक्चुअली मैम मैं मेरा बहुत वेट गेन हो गया है, तो मैं गायनेक दिखाई थी। गायनेक में बहुत सारा टेस्ट दिया और वहाँ पर ना मेरा पीसीओडी का प्रॉब्लम और ओबेसिटी ग्रेड 1 में आ गई है। तो डॉक्टर ने रेफर किया कि डाइटिशियन को दिखाने के लिए। तो मैं यहाँ पर आई हूँ आपके पास एक डाइट चार्ट लेने के लिए, ताकि मेरे ज़्यादा से मतलब बहुत जल्दी वेट रिड्यूस हो सके।
डेफिनेटली मैम, आई विल डेफिनेटली हेल्प यू। मैम क्या उससे पहले मैं आपका डेली रूटीन आप मुझे बता सकते हैं? सुबह से लेकर रात तक आप कैसे क्या खाते हैं, क्या करते
ओके मैम, हाँ हाँ, मैं बता सकती हूँ। एक्चुअली मैम मैं तो बाहर रहती हूँ, 3 साल से मैं बाहर अकेली रहती हूँ। तो मेरा ना मतलब बाहर ही खाना ज़्यादा हो जाता है। सुबह तो मैं उठ जाती हूँ 7 से 7:30 बजे तक, फिर मुझे ऑफिस जाना होता है 9:30 तक। कभी कभी ब्रेकफास्ट स्किप भी हो जाता है, और कभी कभी मैं वहाँ पर कैंटीन में ब्रेकफास्ट कर लेती हूँ, चाय या फिर मतलब बिस्किट वगैरह जो भी मिल जाता है। फिर मेरा दोपहर का भी खाना कैंटीन में होता है या फिर बाहर से ले लेती हूँ, क्योंकि मतलब कैंटीन में अगर वेज वगैरह हो तो मुझे वेज खाना पसंद नहीं है, इसलिए। और मेरा शाम को अगर हैवी कुछ स्नैक्स हो जाए तो मतलब रात का भी डिनर भी कभी स्किप हो जाता है। और मेरा मैम मेजर प्रॉब्लम यही है कि मैं ना बहुत ज़्यादा फूड क्रेविंग होता है। मतलब थोड़ी देर पहले भी अगर मैं फुल पेट खाई, तो फिर भी मैं अगर किसी को खाने के लिए देख लूँ, मतलब ऐसा टेस्टी कुछ खा रहा है, या फिर फ़ोन स्क्रॉल करते करते कोई पिक्चर मिल गया, तो ऐसा टेस्टी कुछ खाना पिक्चर में, तो तभी मुझे भूख लग जाता है, तभी क्रेविंग होता है। मैं इसको कंट्रोल ही नहीं कर पा रही हूँ। मैं समझ रही हूँ कि ये मेरे लिए मतलब डिफ़िकल्ट होता है, मतलब मेरे लिए ठीक नहीं है, फिर भी मैं कंट्रोल नहीं कर पाती। और मैं एक और प्रॉब्लम है कि मैं रात को ठीक से सो नहीं पाती हूँ। मेरा मतलब स्लीपिंग बहुत डिसऑर्डर हो रहा है, रात को नींद नहीं आता है, तो ये भी बहुत प्रॉब्लम हो रहा है मेरा।
मैम जैसे कि आपने बताया आपका जो पूरा शेड्यूल है, जैसे कि आपने बोला कि आपका बार बार भूख लगता है। एक्चुअली आपको भूख नहीं लगता है, आपको क्या होता है, अनहेल्दी फूड क्रेविंग होता है, क्योंकि हम उसको बोलते हैं बिंज ईटिंग डिसऑर्डर। ठीक है। ये अगर आप कंटिन्यू करते हैं तो क्या होता है, कुछ टाइम बाद जाके आप अभी जैसे कि आपका पीसीओडी और ओबेसिटी में आप आए हो, देखिए अगर लाइफस्टाइल आप चेंज नहीं करते हो, फूड हैबिट आप चेंज नहीं करते हो ना, तो क्या होता है कि ये आपको जाके अदर कॉमोडिटीज जैसे कि आपका डायबिटीज, लिवर डिजीज, या फिर आपका फैटी लिवर हो गया, कोलेस्ट्रॉल हो गया, ये सब आगे जाके आपको डेवलप होगा। तो ये लाइफस्टाइल चेंज करना बहुत ज्यादा जरूरी है।
एक्चुअली मैम मैं कोशिश करती हूँ, पहले भी कोशिश कर चुकी हूँ, गूगल वगैरह देखकर ना मैं फास्टिंग या फिर डाइटिंग करने की कोशिश की हूँ, पर मैं मुझसे ना नहीं हो पा रहा है। मैं जब भी मैं देखती हूँ ना कुछ टेस्टी खाना, तो मैं उससे रेजिस्ट नहीं कर पा जाता है, मैं और ज़्यादा खा लेती हूँ, ऐसे ही हो जाता है मेरा। तो यहाँ से मैं कैसे निकलूँ, तो इसलिए आपके पास हेल्प के लिए आई हूँ कि इसको डिसऑर्डर से बाहर कैसे निकलूँ।
यस मैम, डेफिनेटली मैं इसमें आपको डेफिनेटली हेल्प करूंगी। बट मैम पहले मैं बता दूं कि ये जो आपका अनहेल्दी लाइफस्टाइल है, इससे पहले आपको बाहर आना होगा, फिर जाके मैं आपको डाइट प्लान दे पाऊंगी। अभी के लिए मैं आपको की पॉइंट बता देती हूँ, आप उसको फॉलो करो। जब वो आपका सही हो जाए, मैं अपना नंबर आपको शेयर कर दूंगी, तो आप फिर मुझे बताना, उसके बाद मैं आपको डाइट चार्ट दूंगी। तो मैम पहले जैसे कि आपने बोला कि आपने पहले भी ट्राई कर चुके हैं, मतलब बाहर का खाना आप छोड़ के, बट आपका क्रेविंग बढ़ जाता है। आपको एकदम से बंद नहीं करना है, ठीक है? आप थोड़ा थोड़ा खा सकते हो, बट आपको ये देखना है कि बाहर आप जो खा रहे हो आपका हेल्दी ऑप्शन मतलब जैसे कि आपको प्रिजर्वेटिव वाला खाना ना खा के, फास्ट फूड ना खा के, आप जो कि इंस्टेंट प्रिपेयर मतलब जो आपका फ्रेशली प्रिपेयर होता है, जैसे कि फॉर एग्जांपल आपका फ्रेशली प्रिपेयर्ड सैंडविच, बॉइल्ड कर्न, एग, ये सब स्प्राउटेड सैलड, ये आपको बाहर में मिल जाएगा, तो ये आप ले सकते हो। ठीक है। और लेने के टाइम और एक चीज आपको ध्यान में रखना है, आपको क्वांटिटी कंट्रोल करना है। कोई भी चीज आपको खाने को बहुत मतलब मन करता है, आप एक साथ में बहुत सारा ना करके आप कम पोर्शन में आप खा सकते हो, तो क्वांटिटी कंट्रोल बहुत ज्यादा रोल प्ले करता है। फिर मैम उसके बाद जैसे कि आपको मैं और एक चीज के लिए बोलूंगी कि आप ट्राई करो कि आप घर में खाना बनाना, होममेड फूड। मैं आपको कुछ इजी रेसिपी भी बता दूंगी जो कि आपको जल्दी आपका हो ही जाएगा, आपको टेस्ट भी अच्छा लगेगा, तो उसको आप फॉलो कर सकते हो। या फिर सुबह में जैसे कि आपने बोला कि आप जल्दी जल्दी में उठ के चले जाते हो,
हाँ हाँ
तो फिर आपका ब्रेकफास्ट स्किप हो जाता है, राइट?
हाँ, मेरे बेटे।
तो ब्रेकफास्ट में कोई भी मिल, ब्रेकफास्ट हो, लंच हो, डिनर हो, कोई भी मिल स्किप नहीं होना चाहिए। तो आप सुबह उठ के जैसे कि फॉर एग्जांपल 1 बाउल राइस, तो आप वो हार्डली आपको 15 मिनट्स लगेंगे, उसको आप थोड़ा ज्यादा मात्रा में बना के आप ब्रेकफास्ट करके उसको साथ में भी लेके जा सकते हो।
ओके।
मैम आपके यहाँ कुछ मतलब ये स्नैक्स वगैरह कुछ कैरी करते हो?
हाँ, मेरे बैग में पीनट्स या फिर कैशू ये सब रहता है खाने के लिए।
पीनट्स मतलब किस टाइप के?
मतलब जो पैकेट में जो सॉल्टेड वाला पीनट्स आता है ना, वही सब रखते हैं बैग में।
तो मैं उसके जगह पे कहूंगी आप पीनट्स और कैशू ले सकते हैं, बट वो पैकेट वाला ना लेके आप फ्रेश वाला लीजिए। ठीक है, जैसे रोस्टेड पीनट्स हो गया, आपका कैशू हो गया, आलमंड हो गया, या फिर आपका रोस्टेड मखाना, रोस्टेड चना, या फिर आप सत्तू भी ऐड कर सकते हैं खाने में।
एक्चुअली
तो
मैम मुझे ना सत्तू डाइजेस्ट नहीं होता है, मेरा ब्लोटिंग हो जाता है सत्तू खाने से।
मैम वहाँ पे मैं आपको एक न्यूट्रिशनली बैलेंस सप्लीमेंट आपको रेकमेंड करूंगी। तो जिस टाइम आपका मिल्क स्किप हो जाता है, तो उसको आप ले सकते हो, ये साइंटिफिकली प्रूवन रहता है। तो जैसे कि आपका फूड हैबिट सही नहीं है, तो आपको क्या होता है, माइक्रो और मैक्रो न्यूट्रिएंट का डेफिशिएंसी आ जाता है, तो ये आपको वो चीज में फिलअप करने के लिए भी हेल्प करेगा। ठीक है, तो इसको भी आप ले सकते हो। कंटिन्यू नहीं लेना है, कुछ टाइम के लिए, या फिर आप जब मिल्क स्किप हो जाता है उस टाइम।
ओके
और
ओके।
आप ना फ्रूट भी रख सकते हो, जबकि इजी टू कैरी भी होता है, रिच इन फाइबर, क्योंकि आपको बार बार भूख लगता है, आपका हंगर सेंसेशन को कंट्रोल करने के लिए आपको हेल्प करेगा। ठीक है, तो उसको भी आप रख सकते हो। और एक मैम जरूरी चीज, जो कि आप जो भी खाते हो खाना, आप स्नैक्स ले रहे हो, मेन मील रहे हो, जो भी ले रहे हो ना, माइंडफुल ईटिंग बहुत ज्यादा जरूरी है। आप जो खाते हो किसी भी टाइप का डिस्ट्रैक्शन नहीं रहना चाहिए, जैसे कि आपका मोबाइल, बहुत टाइम मोबाइल देखते देखते या फिर इससे बात करते, फोन में बात
हाँ,
करते
वो
करते आप
होता
खाते
है।
हो। जी, होता है ना। तो यस, तो उससे क्या होता है कि आपका ओवर ईटिंग आपको पता नहीं चल पाता है, तो आप कितना खा रहे हो वो डाइजेशन में आपको इफेक्ट करता है। ठीक है? तो आपको अगर
ओके।
खाने खाने को अगर आप अच्छे से ऑब्जर्व करके, थोड़ा टाइम लगेगा कि अच्छे से मतलब चबा के खाओगे ना, तो डाइजेशन भी होगा और आपका अच्छे से डाइजेस्ट भी होगा और आपका क्वांटिटी भी कंट्रोल होगा। और मैम हाइड्रेटेड रहना बहुत ज्यादा जरूरी है। हाइड्रेशन जैसे कि पानी हो गया, या फिर कोई भी फ्लूइड, कोकोनट वाटर हो गया,
हम
या फिर
कितना
आपका
पानी
दही,
पीना पड़ेगा?
आप 2 to 3 लीटर ले सकते हैं। सिर्फ ऐसा नहीं कि आपको पानी ही लेना है, आप पानी की जगह पे कोई भी फ्लूइड, जैसे कि आप कोकोनट वाटर हो गया, छाछ हो गया, दही हो गया, आप स्मूदी भी बना के रख सकते हो। ठीक है, तो ये भी
ओके।
आपके लिए अच्छा ऑप्शन रहेगा। ठीक है, देन एक्सरसाइज, आप क्या कोई एक्सरसाइज करते हो?
नहीं मैम, एक्सरसाइज तो वैसे नहीं होता है।
एक्सरसाइज जरूरी है, जितना डाइट जरूरी है उतना एक्सरसाइज भी जरूरी है। तो आपको मैं बोलूंगी कि आप जस्ट स्टार्ट करो एक डेडिकेटेड टाइम। जरूरी नहीं कि आपको पहले से ही बहुत टाइम, 30 मिनट, 40 मिनट्स, 1 आवर करना है, ऐसा नहीं। आप जस्ट स्टार्ट करो, 10-15 मिनट जितना आपसे हो पाए, योगा, मेडिटेशन, या फिर आपका अगर आपको डिमोटिवेट फील होता है या फिर आप कर नहीं पाते हो, ठीक है, तो उस केस में आप योगा क्लासेस, जिम, ये सब भी आप ज्वाइन कर सकते हैं। और टाइम जैसे कि आपको आपको एक डेली रूटीन में एक डायरी मेंटेन करना हो, जैसे कि आप सुबह से लेकर आप क्या खाते हो, क्या कितना का पानी पीते हो, या फिर आपका स्लीप पैटर्न कैसा है, इसको एक डायरी अगर आप मेंटेन करेंगे ना, तो आपको ही पता, आप खुद ही खुद को ऑब्जर्व कर पाएंगे कि आप कितना बाहर खा रहे हो, कितना हेल्दी खा रहे हो, कितना अनहेल्दी खा रहे हो, ये भी
ओके
आपको
ओके
इफेक्ट करेगा। और जैसे कि आपने नींद के बारे में भी बोला, राइट, स्लीप,
हाँ
मैम स्लीप भी बहुत ज्यादा जरूरी है। तो रात को मैं बोलूंगी आप जैसे कि स्क्रीन टाइम थोड़ा लिमिट कीजिए। ये कोशिश कीजिए सोने से मिनिमम 1 आवर बिफोर आप मोबाइल या फिर कोई भी स्क्रीन आप ना देखिए, इलेक्ट्रॉनिक कुछ भी आप यूज ना करें। आपको अगर नींद नहीं आता है, आप कोई जैसे कि स्लीपिंग मेडिटेशन बहुत सारा होता है, योगा निद्रा वगैरह होता है, तो वो भी आप कर सकते हो। उससे क्या होता है, आपका स्ट्रेस भी रिलीफ होगा, आपको नींद भी अच्छी आएगी।
ठीक है ठीक है।
लेकिन मैम अगर आपको कोई भी टाइम में बहुत ज्यादा स्ट्रेस या डिप्रेस फील होता है, तो मैं बोलूंगी आप अपना क्वालिटी टाइम कुछ ऐसी चीजों में लगाइए, जैसे गार्डनिंग हो गया या फिर कहीं पे घूमना हो गया जो आपको अच्छा लगे, या फिर अपने क्लोज वन के साथ आप टाइम स्पेंड करिए, तो वो भी आपके लिए बहुत अच्छा रहेगा। ठीक है। तो होप कि मैंने आपको जो जो पॉइंट बताया वो आप इजीली फॉलो कर पाओगे, राइट।
हाँ मैम, मैं कोशिश करूंगी पूरा, मतलब अभी तो मेरे लिए मतलब मुझे ओवरकम करना ही है इससे, तो आपका मदद मिल जाएगा तो मैं और जल्दी कर सकूंगी।
जी जी मैम, 100% मैं आपके साथ ही हूँ। मैं अपना कांटेक्ट नंबर शेयर कर दूंगी। आपको कोई भी कंफ्यूजन आता है या गूगल में सर्च ना करके आप मुझे कांटेक्ट कर सकते हो। और एक इम्पोर्टेंट बात, आप जब भी आप जैसे कि डाइटिशियन के अंडर में हो, तो आप कभी भी ना ये बात दूसरों से शेयर मत करना। हाँ, आप अपने डॉक्टर से शेयर कर सकते हो या फिर अपने थेरापिस्ट से आप शेयर कर सकते हो, ठीक है।
ओके मैम।
उसमें कोई, मैं आपको कुछ टेस्ट लिखती हूँ, तो वो टेस्ट जैसे कि आपका लिवर फंक्शन टेस्ट, सीबीसी हो गया, आपका शुगर टेस्ट, थायराइड, ये आपको मैंने लिख दिया है, तो वो आप थोड़ा करवा दीजिए, ठीक है। तो उसके बाद आप मुझे रिपोर्ट भी शेयर कीजिएगा। एक बार ये आपका लाइनअप हो जाए, थोड़ा हेल्दी लाइफस्टाइल में आप आ जाओ, आप मुझे बताइएगा, मेरा नंबर तो है ही आपके पास।
हाँ
उसके
मैम।
बाद उसके बाद मैं आपको डाइट चार्ट आपके हिसाब से बना के दूंगी, उसको आपको मिनिमम 4 to 6 मंथ आपको कंटिन्यू करना है, तो धीरे धीरे आपको इम्प्रूवमेंट आ ही जाएगा।
ओके मैम, ओके, थैंक यू सो मच, मतलब आपसे बात करके मुझे बहुत मोटिवेशन मिला। और मैं ना यहाँ पर आने के आगे सोच रही थी कि मतलब बहुत डर गई थी कि क्या होगा, मतलब पूरा पूरा डाइट बिगड़ जाएगा या खाना सब बंद कर देंगे, बॉयल खाना देंगे, ऐसे ही कुछ मतलब आइडिया था। पर आप तो मतलब जो भी हम खाते हैं उसका हेल्दियर वर्जन बता दिए हैं, तो अभी मुझे बहुत अच्छा लग रहा है और मैं अपनी 100% दूंगी इसे ओवरकम करने के लिए। और मतलब मेरे फ्रेंड्स और फैमिली को भी बताऊंगी कि मतलब खाना मतलब डाइट का कितना बड़ा पार्ट रहता है हमारे जीवन में, और डाइटिशियन का भी कितना इम्पोर्टेंस होता है हमारे पूरे लाइफ में, खाना क्या क्या चूज करना है, नहीं चूज करना है, इन सब के लिए। तो थैंक यू सो मच मैम।
वेलकम।
Wonderful role play done by both of you. I will request all the speakers to now switch on your video. It is a very practical role play. Deblina have been a very practical patient coming with all the problems, and dietitian Chinmoyee. We have also done a great counseling. So the thing is that as a dietitian, our first job is not to just hold a piece of paper which is termed as a diet chart, right? Our first job is to counsel the patient, be empathetic to the patient, and to console and motivate the patient so that first she or he can try from herself. And once he or she can see the efforts, the positive sides, then there is no way back, right? She will automatically place herself in this healthy lifestyle and will tend to be much healthier in this journey. So very nice presentation by all of you. Today we have learned so many things, and I am seeing that in the chat box there are many corporate dietitians. So I would like to request anyone to share their views. I think anyone can say that if they have got this type of patients, And this scenario is quite normal because in the corporate lifestyle, this type of problems, the hectic schedule is there. So I can request anyone to share their views or can add on if you want to give any idea or tips that how you do your counseling to your patient. So you can just raise your hand or can unmute yourself. Anyone from the chat box, from the audience?
It is really a very good conversation in between both of you. So we get to know many things from you. So real counseling, it is actually the real counseling. So I have to leave the session, and congratulations to all of you. Thank you, Pritha, once again, and thank you all of you. So Pritha, there is any question?
No, sir. There
Okay.
are nice feedbacks and reactions from the middle of the session as well. So I
Thank
think
you,
all
thank
the
you, thank
audience
you.
have appreciated the session.
You can continue the discussion for more 5 minutes. Huh?
So
Okay.
I am just stopping the recording.